Hi, Oluchi here. Today I'm going to be talking about code status. There is a striking difference between how we approach medical emergencies with how it is approached here. Back home, if a patient comes in as an emergency, or his condition or her condition deteriorates even while they are on admission, the first thing on the heart, in the mind of every health worker handling that patient is to resuscitate the patient. So you don't think of anything, you just go straight and start resuscitating the patient. But here, it's not like that. You have to know if the patient wants to be resuscitated, the extent to which the person wants to be resuscitated, because before you lay your hands on that patient. So because of emphasis on patients' rights and legal issues here, the first thing you should do when you have a patient is to find out their code status. That's how their position about what they want done for them in case of a medical emergency. So basically, there are three ways it can go. The patient could be full code, the patient could be limited code or partial code, and the patient could be DNR, DNI, or just DNR. That's do not resuscitate. So some patients do not want to be resuscitated when they have a medical emergencies. Some want to be resuscitated, but there are some items on the list of resuscitative procedures they want, while there are some they don't want, while others want to be fully resuscitated, which is what is referred to as full code. So full code, do everything you can. They can be placed on a mechanical ventilator, they can be intubated, they can be given resuscitative medications, they can be hooked to a feeding tube to give them nutrition when they can't do it for themselves. So everything that can be done, everything that is in the power of the hand of the providers to do to bring the patient back, the patient wants it. That's full code. Limited code, like I said, is when the patient wants just some things out of the list. The patient could want mechanical ventilation but does not want to be intubated. The patient could want medications, as in life-giving medications, maybe like adrenaline and all that, but they don't want ventilation, or they don't want a tube inside of them in anywhere on their body. So it depends on what the patient wants. So you as a nurse should find out what is the patient's code status. Is it full code? Is it limited code? Is it DNR, DNI? DNI is do not intubate. So sometimes it comes in a pair. DNR, do not resuscitate, do not intubate. Sometimes you just see DNR, do not resuscitate. Some patients wear it as a bracelet. So whether they wear it, don't go by what they wear as a bracelet. What you should do in the hospital setting, at least, is to go in their medical records and find out exactly what they want. Now, these requests or choices can be expressed as advance directives. That's when somebody states what they want done for them, where in the if peradventure they are not able to make those decisions for themselves. Another way they can express it is by saying it verbally when they are in the hospital, so it's documented in their chart. Another way it can be said or expressed is by the use of a medical power of attorney. That's somebody outside of the patient that makes medical decisions for the for the patient. So the person might be a child or a spouse or a friend or whoever that the patient assigned to be his or her medical power of attorney. So those are the basic things that entails code status. Thanks for listening. Make sure to like, share, subscribe, and follow for more.